Straight Talks with University of Nebraska Beef Extension. My name is Sydney O'Daniel, and today I want to talk to you about reproductive management and some tools for pregnancy diagnosis this fall. There's three main methods of pregnancy diagnosis in the form of palpation, ultrasound, and a blood test. I'm going to discuss with you some of the benefits and limitations of each and what might be best for you. Let's start with rectal palpation. Rectal palpation is probably going to be one of the cheaper methods of pregnancy diagnosis. However, it does have some drawbacks in the form of scheduling. So when the best time it is for you to bring your cows up and work them might not be the best option for your veterinarian or the technician that you plan to utilize. As well as it's very variable on the skill of the technician. Pregnancy can be determined by palpation as early as 35 to 45 days. However, it's more realistic to estimate around like 50 to 60 days for the average skill set of the average technician. However, a very experienced one will be able to determine pregnancy much earlier on than that. So it really depends on who you're working with. Next, ultrasound is a great tool for pregnancy diagnosis because it allows you to determine age of the fetus, sex of the fetus, as well as the presence of twins. However, this is also very variable on the skill set of the technician. They have to be able to utilize the probe appropriately, as well as be able to read the ultrasound images accurately. So finding a good ultrasound technician will be important as well. Ultrasound is also going to be one of your more expensive methods. And again, you're going to have that scheduling conflict as well. A blood test is another great tool for pregnancy diagnosis. However, it doesn't give immediate results. Depending on the test that you use, it can take anywhere between a couple hours to a couple days to get your results. So that really limits your ability to immediately sort those females and determine if they're going to go out to pasture, or if they're going to go to the sale barn, or how you want to market your opens. The great thing about a blood test is that you have complete freedom for scheduling. So you will be able to draw blood on those females when it's convenient for you, and you don't have to try and work out a schedule with a veterinarian or a technician. And so really that can be done on your own time. And it's also going to be one of your cheaper options as well. An important detail to note about blood tests is that they can be the most accurate method, between 99 to 95% accurate in determining your bred females. However, that has to be done 90 days postpartum because maybe a late calving cow that you blood test with the rest of them might not be 90 days postpartum, and that can lead to false positives because their hormones have not gone back down to normal cyclicity. And also blood tests can be pretty comparable to ultrasound, that they can be used around 28 to 30 days post-breeding. So that time frame is a little bit similar. So it really comes down to the economics of each of these pregnancy diagnosis methods of what's going to bring the most return to your herd. It is important to use a pregnancy diagnosis method because retaining an open female over winter can cost between $100 to $200 in feed and supplements. So being able to separate your pregnant and open females and market them in a timely fashion is really going to bring a great return to your operation. For further questions or information, please visit the Beef Repro website or the Beef Watch archive, or reach out to your local Beef Extension Educator. Thanks for watching.